So today we got an amazing topic. And I'm saying amazing because this is a topic that I'm very, very passionate about. And this is the topic of osteoarthritis. Due to my own health journey, struggling with multiple chronic symptoms, and one of them was joint pain. I had multiple pains and aches of my joints, and I learned through my functional medicine, nutritional medicine journey how to resolve these issues without pain medication. I was really blessed and honored to be able to focus in the first few years of my practice mostly on chronic pain patients. So we would see a lot of patients with joint pain, arthritis, osteoarthritis. And this is where I feel like functional and integrative medicine really shines. And you can really do a lot to help those patients by understanding the root cause, what's driving that inflammation, and also offer natural solutions to reduce pain, reduce the rate of degeneration, and to bring your patient a better quality of life without the side effects of excess medications. This has been really a blessing, and we wanted to share with you. Of course, this is going to be sort of like a mini discussion and a mini class. If you yourself or family member or somebody that you know, your patients are coming to see you and they're struggling with degenerative, chronic, painful joint conditions, then this is the mini class for you.
This is actually near and dear to my heart as well, not only for myself, just because being extremely active, I'm constantly looking for alternatives to pain medications or even, what's constantly out there, just from a functional medicine perspective on how to optimize my joints, how to optimize my muscles, how to optimize my activity. When I was in med school, I did a lot of rotations in sports medicine clinics and pain management clinics. And that was a huge part of my first clinic when I first started practice. Oftentimes, I would get patients coming to see me wanting alternatives to their pain, right? Or their degenerative joint conditions such as osteoarthritis. They didn't want to constantly be on NSAIDs, or some practitioners and some doctors were even prescribing steroids for them, and they didn't want to constantly be on that. So the first question I always asked myself was, what is a primary driving factor that is causing their pain to be chronic? They would come in and one of their features was that they were in chronic pain. They would take medications, it would go away for a little bit, it might improve for a little bit, it might decrease the pain from like a 7 to 8 to a 2 to 3 for a little bit of time, and then it would come back. So what was that driving factor that was causing that pain for them and making it chronic? So they had to stay on those medications. That's why they were coming into me, right? They wanted to get off of those medications or those NSAIDs or those pain meds. And one of the root causes that I found that was a driving factor to that chronic pain was inflammatory foods, specifically foods with omega 6s. You may have heard that omega 6s are extremely healthy, and they are up to a certain point. What is occurring is that omega 6s are overpowering omega 3s, right? Omega 6s, if you have excess omega 6, this can actually lead to chronic inflammation, which is the driving factor to that pain that the patients were experiencing. And osteoarthritis is associated with chronic inflammation and chronic low-grade inflammation. And it is often accompanying that osteoarthritis or that pain, and it's causing that joint-specific inflammation or that joint-specific pain. And there's also often systemic inflammation that is involved with that, which is coming from the omega 6s. And there was a really interesting study that was completed, and this was published in the Clinical Journal of Pain in 2018. And it was showing that omega 6s, especially high levels of omega 6s, are associated with that inflammation and nociception with physiological stress. And that was all related to omega 6s. They did a cross sectional investigation and experiment on 167 adults ages from 45 to 85. They had knee osteoarthritis, and they assessed for their physical pain, their psychosocial functioning, and then they looked at their clinical pain results. They also took blood samples of their plasma omega 6s, plasma omega 3s, and the ratios, and they compared them. What the results showed was that these adults that had higher omega 6s compared to their omega 3s were associated with having greater amounts of pain, both clinical along with functional limitations, and increased their pain sensitivity and their pain severity. We understand that omega 3s or higher levels of omega 3s are associated with lower levels of inflammation, right? Because it's anti inflammatory. And then omega 6s, when, as we were stating, this can actually be pro inflammatory. And that pro inflammation can actually be good, right? Because we need that for producing prostaglandins, right? We need those omega 6s, but it's when it is in excess that it becomes an issue. And there's a great picture that I want to share with you that's going to kind of outline the omega 6s versus the omega 3s. So on the left hand side here, we can see that the omega 6s are made up of linoleic acid, arachidonic acid, right? And these are coming from food sources, as I was saying in the very beginning, inflammatory food sources containing omega 6s. And some of the food sources are going to be things like corn, especially corn oil or other vegetable oils, factory farmed meats. All of those contain high amounts of omega 6s. Over time, that becomes pro-inflammatory by releasing prostaglandins and leukotrienes. And these are all inflammatory cascades from your immune response. And that is what's causing the systemic inflammation and then inflammation in your joints. Versus the omega 3s, which we're seeing on the right-hand side, right? The ALA, the alpha linoleic acid, those are coming from things like flax seeds, or the EPA coming from things like wild salmon or fatty fish. That is going to convert into DHA, and that is going to have anti-inflammatory effects, or it's going to help to resolve inflammation that is already there. It's important to note, as I was stating, that omega 6s are still needed, but it is that excessive amount of omega 6s that is causing the issues, especially with our chronic pain patients. So a healthy ratio with omega 6s versus omega 3s ranges from about 1:1 to 4:1. What's interesting from today's age with our factory farmed meats, standard American diets, in the Western world now, that ratio has gone up to 20:1, right? Instead of the 1:1 or the 4:1, which is the healthy ratio, we're seeing that people are at a 20:1 omega 6 versus omega 3s. So that is causing a lot of inflammation and a lot of chronic low grade inflammation, which is exaggerating or exacerbating the pain for our osteoarthritis patients. And we are seeing this because of the consumption of omega 6 things and foods such as seed oils, soybean, corn. If you've gone to any fast food place, right, they're going to use these types of oils, which actually turns into trans fat. But what it's showing is those omega 6 to 3 ratios are 60:1 or 77:1. And so if you are consistently incorporating that into your diet, what is happening to your body is that your ratio is turning from what should be a 1:1 to 4:1 ratio of omega 6s to omega 3s to about 20:1 or higher. And what I'm seeing with my chronic pain patients when I tested those ratios were that were extremely elevated in their omega-6s. And when we addressed that, they decreased their pain medications because their pain was decreasing due to the decrease in inflammation. So my patients were extremely excited about this. There was something that was actually working for them without them having to take all of these pain medications.
This is one of the most important factors to understand that most practitioners don't talk about. Just to clarify, Dr. Chill already mentioned it, but it's always good to clarify again that omega-6 by itself is not a harmful compound to our body. It's actually beneficial, and there's even supplements that contain both omega-3, 6, and 9 together. And omega-6 is definitely needed in the body for multiple processes. The problem is with the industrial revolution, the processing of food, we have shifted our diet significantly from what our bodies required, our ideal, let's call it our ideal ratios, right? Omega-6, when you think about it, it's very high in seeds and oils. For example, soybean, corn, safflower oil, canola oil contains twice as much omega-6 than omega-3s. Peanut butter, right? It's an American staple in peanut butter sandwiches, eggs, mayonnaise, and avocado oil. Now, again, not to say that eggs are not healthy and not to say that avocado oil is not healthy, right? It's just that what are the ratios, right? And when you meet in a patient that eat peanut butter every day and they cook with canola oil, then it tells us something about those ratios, right? And they're eating meat, pretty much living off meat and chicken, which are low in omega-3s. The only way to increase omega-3 in animal protein is to buy grass-fed. There's actually a survey that was done, really interesting survey, that sampled conventional meat versus meat from cows that were pasture raised, which means that they were eating grass instead of grains, right? And they found that there is about 60% higher amount of omega-3s in the meat of the pasture-raised cows. So it's good to know that, because if the patient really just likes to eat meat, that might be a good recommendation to buy pasture-raised or grass-fed meat because it has higher omega-3s. Now, when you think about canola oil is quite problematic because it is a sneaky and hidden ingredient in multiple products: cookies, crackers, granola bars, different snacks. It's heavily used in the food industry because it has vitamin E that is beneficial. It has some antioxidants that are beneficial. Although when you start cooking with it with very high temperatures, some of it goes rancid. So it's very debatable still if canola oil is a healthy thing or not, but it is very high in omega-6. And it's the second most popular cooking oil in the United States. It's very cheap. So restaurants will typically use canola oil. If you eat outside or your patients eat out, they most likely use canola oil. It's also used to mix into olive oil. So a lot of the olive oils that we're buying here in the United States, unfortunately, are fake. And there was multiple reports about it from Consumer Report and olive oil associations that reported that some brands are mixed of canola oil and olive oil. And as long as there's like a certain amount of olive oil in the bottle, they can still call it olive oil and sell it as olive oil. We are currently consuming in the US in 2022 close to 3 million metric tons of canola oil domestically, which is more than 3 times that we used to consume 20 years ago. Ask your patients, what are you eating? Are you diversifying your diet, right? Are you also eating seafood and fish? Are you mixing up your foods to make it diverse, right? So that's all important. And of course, we're going to talk about supplementations very soon.
That's the biggest thing, right? Is asking your patients what they're eating. And that's what's great about the functional medicine survey, because it asks them right on that survey, what is your diet? Are you eating a lot of dairy all day? Are you having tap water? Like those kinds of things. What kind of oils are you using? Those are the things that you want to ask these types of
Mhm.
patients, especially patients that you are suspecting that have a lot of chronic inflammation that is going on, because you want to look at all of their factors that are contributing to their inflammation, so you can help them with avoiding those factors or minimizing those factors to reduce that inflammation for them, and then thus kind of reducing many of their symptoms that they have. We're really kind of investigating all of the factors to inflammation in functional medicine with our patients.
So let's dive into root cause number 2. And this is gut health and the relation to osteoarthritis. Gut health is a really interesting topic. Hippocrates, who was considered to be the father of medicine, once said, all diseases begin in the gut. And that was over 2,000 years ago. And so it's interesting that today, with modern science, we got studies that are showing us that changes in our gut could lead or contribute to chronic activation of inflammatory pathways that eventually contribute to osteoarthritis. This is from a published study from 2022. As usual, we always try to look at the most updated and current studies whenever possible. And in this picture, we can see how changes in our gut bacteria could lead to dysbiosis, meaning that you might have more harmful or pathogenic bacteria and a lower amount of beneficial bacteria. So that's essentially an sort of imbalance that we can call dysbiosis. There's other names for it, of course, depending on the situation. That could be also SIBO, that could be also fungal. There's multiple factors that are involved, but let's keep it simple for now. What happens essentially when you have overgrowth of these imbalanced pathogenic or harmful bacteria, you're most likely going to produce more inflammatory cytokines. That's what you're seeing on the top, right? More inflammatory cytokines and more systemic inflammation over time, which accelerates the destruction of our joints, the inflammation in our joints. So on the top left side, you can see the types of bacteria species that are found to be associated with obesity and osteoarthritis. So on the top, you can see there's lactobacillus, streptococcus. There's 3 examples of species of bacteria that if they increase in our gut, they can contribute to, they're associated with increase of inflammation. As a side note, it's important to mention that this is a very general view, but I want you to understand the concept. We know that some lactobacillus species are beneficial and are actually sold in the supplement industry as a probiotic supplement. So again, this is very general. It's mostly for you to understand the concept. When we dive into this in our comprehensive training and advanced training, we learn about the specific strains of each one of those bacteria. So when you look at your patient's GI analysis, you can say, oh, now I understand these bacteria. They have overgrowth, a larger amount of this bacteria, and that's associated with osteoarthritis, right? So we have to prioritize taking care of this. On the other hand, what you can see here is that if you have a reduction of certain bacteria species, that is also associated with osteoarthritis, right? So you might ask yourself, wait a second, how is that possible? One of those bacteria, beneficial bacteria, is bifidobacterium. And we know that bifidobacterium produces short chain fatty acid. It's part of their metabolites, the bacterial metabolites, when we eat fiber, food that contains fiber. Especially most important for osteoarthritis is the short chain fatty acid acetate, which was shown to reduce the production of pro-inflammatory cytokine interleukin 6. Now, if your patient has, let's say, more or overgrowth of the harmful or imbalanced bacteria, right, that is associated with excess inflammation. But if they also have lower amount of beneficial bacteria that sometimes goes hand in hand, they would also have less of a production, a lower production of short chain fatty acid, especially acetate, which is important. There's multiple types of short chain fatty acid. We got butyrate, we got acetate, we got other ones, but acetate is the most important, is one of the most important ones for reducing those inflammatory cytokines. So in some cases, when we look at those patients' tests results, we might supplement them with specific probiotic that we talk about in the advanced program that is based on research to reduce the inflammatory markers, because we want more production of short chain fatty acids. We want to inhibit those inflammatory pathways, right? Sometimes when we look at a patient's GI analysis and we see that there is overgrowth of the pathogenic or imbalanced bacteria, we want to clear this bacteria, right? So we might have a herbal antibiotic protocol for a certain amount of time, right? We have specific studies, human clinical trials that we follow those protocols that were used to be and to show us the safety and effectiveness. But that's essentially two of the mechanisms. There are others, but those are two of the mechanisms. Now, these types, some of these bacteria, on the top, you can see obesity. Some of these bacteria were also found to be associated with obesity, right? So again, that's another connection between osteoarthritis and obesity. This is one of the mechanisms that I wanted to talk about, which is the gut bacteria. And as I mentioned, there's multiple mechanisms that we're diving in the advanced program, specifically learning how to read the symptomatology. So when you're talking to a patient, the more you understand the mechanism, the better you can start picking up on the cues and the sign and say, oh, this patient might have overgrowth of harmful bacteria or imbalanced bacteria. And then you already know which lab test to order, right? So once you get the lab testing, it's also important to understand the biomarkers, understand not just looking at the bacteria, but also looking at the byproducts of the bacterial fermentation. And you can see, oh, okay, they got more of this short chain fatty acids, or they got more of these biomarkers. Now I need to supplement. I know exactly what to supplement. In general, lower amount of the beneficial bacteria, we would supplement with probiotics and add fiber. We always want to add the prebiotic as well, not just probiotic, but also prebiotic. On the other hand, if they have pathogenic, harmful, imbalanced bacteria, right? Those that, those might not be the bad guys, but under certain conditions, they might contribute more to inflammation. Then we might need to do some clearing of those as well. Because if you give probiotic or you give fiber to a patient that has imbalance or pathogenic bacteria, you might grow those bacteria as well. The patient will come back and might tell you, doc, I took this probiotic and I'm super bloated. I feel discomfort. I'm constipated. So we always want to remember that when we work with patients, that we have to look for those signs of the imbalanced bacteria. The lab testing is not very expensive. You can get lab testing as affordable as $120 all the way to the fancy, really, really advanced metabolic tests that are like $360 or $400. And that tells you everything. Tells you how do you break down carbs, break down protein, fat, secretion of enzymes, inflammatory markers. It tests for multiple factors, right? And we dive into all of those. And then the last factor that I wanted to dive into, mention at least, we're not going to go, it's a very deep, very big topic. Intestinal permeability. We got probably 4 to 6 hours just training on intestinal permeability and how to treat it, how to look for it. I wanted to mention that because it's really, really important, because if your patient have a state of leaky gut, let's call it leaky gut to simplify it, essentially what happens is bacteria and bacteria metabolites and proteins like lipopolysaccharides could leak into the bloodstream. And lipopolysaccharides are essentially glycolipids. They are a part of the outer membrane of a gram-negative bacteria. And when your immune system encounters those in our bloodstream, you get a very strong immune reaction. Why am I mentioning all of this? Because there are some really cool and interesting studies coming out in the last 10 years. One of them was conducted in osteoarthritis patients, and the authors, they took samples and they found a connection between lipopolysaccharides, serum and synovial fluid, connection with the activation of macrophage in those patients' knee joints. And so there was also a connection between lipopolysaccharides levels and the degree of joint space narrowing, osteophyte formation, and increased pain scores. The study is called Both Systemic and Local Lipopolysaccharides Are Associated with Knee Osteoarthritis Severity and Inflammation. This was published in 2016. So very interesting. Of course, there are a lot more different mechanisms. And once you understand each mechanism and each pathway, how from the gut to the joint, it causes more inflammation and degenerative condition, then you also learn about the specific lab testing and the specific supplement or compound that can help with all of those. So the two major ones, if you just remember two from today, is one, inflammatory food. What we see a lot is the high consumption of omega-6. And the second thing is gut health, gut function, gut microbiome, gut integrity. Very, very, very important.
This is something that isn't often discussed in pain, right? Because it's often just given a medication, right? I love this discussion because when you take a look at these underlying factors, you could really help your patients out that they haven't been helped out before because they're experiencing this chronic pain for such a long period of time. And when you look at addressing the omega-6 factor with the chronic inflammation or the lipopolysaccharides with the intestinal permeability causing more inflammation that is increasing their pain for them, and you address all of those things, their pain starts to go away. And you start to get these really loyal patients because you actually start to listen to them without just throwing medications at them. So I'm really excited that we're giving you this information. As I was saying, this isn't often discussed in a chronic pain situation.